Hi, let's talk about ENT as your career option, a tech-driven branch that nobody talks about. First, talking about the pros. Balanced life. OPD plus elective OPDs with very less 3am calls maybe related to epistexis or some airways. Second, gives you the selectivity for both OPD as well as for surgery. If you feel that no, I can't do the surgery, you can always go for the OPDs like the allergy, vertigo clinic and the speech clinics that is serving very good in the metro city. Third, it is not only limited to ear, nose and throat, but it also goes into skull and head and neck. So that gives you a chance for endoscopic, microscopic and also the open surgeries. Next, crossover. You could easily go after completing your MS or DNB as a fellowship and also as MCH in plastic surgery. Talking about the cons, definitely very steep learning curve because it is a microscopic surgery with very tiny anatomy, same like ophthalmology. Second, early income is modest and you need a lot of time to have a better money. Third, very important, saturation. And this saturation, mind it, it's not only in ENT, it is in all the fields of medicine. Especially in ENT, the saturation is more in the metro cities. And then there are certain critical emergencies like, related to the airways or maybe related to the epistexis or maybe related to the ear trauma. So these are the critical emergencies that you could be getting after 3 am. But these are the cons that any of the branch could have. And relatively, ENT is having less cons and more pros. Now, who should consider ENT as their option? Definitely, who are the tech lovers and most important, the steady hands. Apart from that, those who are enjoying both OPD as well as the surgery. And please remember that this rapport needs time, so you should have patience in ENT for sure. Whom should think twice before considering ENT? First, who wants high adrenaline trauma, who requires a lot of money during the first 3-4 years passing out their MS or DNB. Third, who dislike the delicate surgery because ENT is very precise and delicate. So there are not so much like kisko nahi leni chahiye, anyone could take, but please consider twice before taking ENT if you are someone who always opted for ortho or surgery and now finding it difficult कि क्या मैं major surgeries के बाद इन micro surgeries को कर पाऊंगा या कर पाऊंगी. Finally, what after your MS or DNB? You can easily go for a fellowship in otology, advanced rhinology, or sleep surgeries, facial plastics. You could do the MCH after this. Along with that, if you are someone who is not liking a lot of surgery or something, you can go for the OPD services and then comes the academic. But please remember, ENT is a very good option if you are thinking of a chill work life with the OPD experience and enjoying your life to the fullest with a good dopamine rush in the OPD as well as in the surgery. So take care, think wisely before you're choosing ENT. Bye.